Hi, my name is Dr. Manish Rao. I'm a consultant child and adolescent psychiatrist. Some young people who have a diagnosis of autistic spectrum have some sensory differences, and I'm here today to talk about that in a little bit more detail. Let's get into it. So when we're talking about sensory differences, what does that mean? So essentially we're talking about people's senses, so that can be smell, or sight, or touch, and people who are on the autistic spectrum can experience them in different ways to neurotypical people. Sometimes that means that they feel them more keenly than other people, and sometimes it can be the opposite too. Thinking about some examples that can really help bring that to life, I'm thinking about things like when children go to a children's birthday party. Now that can be really sensory stimulating, so there's lots of noise there, there's loads of people around, there's lots of lights that can be present. For some neurotypical children that can be absolutely fine and no problems whatsoever, but for those on the autistic spectrum sometimes that can be really overwhelming. That can also apply for other situations. For example, when people are at school, I'm mindful about the school bell. That can be really difficult for some people, or when people move chairs in the classroom, they can really hear that and experience that much more keenly than some other young people. But it goes the other way too, so it could be that they are less responsive to some sensory elements too. So for example, if a young person is really interested in a topic and a parent might call out their name, or someone is trying to get their attention, they can be so focused on the things that they're doing that they won't be able to hear what other people might be saying. So there's a really wide variety of things in relation to sensory differences that people might experience when they're on the autistic spectrum. People sometimes talk about being hypersensitive or hyposensitive to something. Now that sounds really confusing. Basically what that means is when we talk about being hypersensitive, that means that you experience things more than maybe other people might. So that can sometimes be in relation to, for example, clothing. One of the really common things people talk about being hypersensitive to is the clothes labels that people might have and the need for them to be cut off because it can just be a bit too uncomfortable for people on the autistic spectrum. And that's one example of being hypersensitive to things. Or another is actually when going into bathrooms and there are hand dryers and the noise from that being really, really difficult for people to manage. And when talking about those kind of hypersensitivities, sometimes there's certain things that can be done to help support young people with that. For example, as I mentioned, cutting off the clothes labels, or wearing ear defenders if noise can be a real big stimulus for people. When thinking about hyposensitivities, that is the opposite. So that means people are experiencing those sensations less than maybe others might. An example could again be about not necessarily being able to pay attention to noises in the same way that others do, and often that's related to when people are so focused on something that they're really interested in that they don't pay attention to any other noises, typically people calling out their names. And so that's an example of when someone's senses can be slightly lower than others would expect, and that's what we term hyposensitivity. I guess the main thing is trying to make some adaptations depending on what that sensory difference could be. So I've mentioned some examples about how to support young people in relation to their sensory differences, like the noise cancelling headphones. Other things that can be helpful can be making sure there's a quieter environment for some children and young people. Sometimes things like sunglasses can be helpful if they're sensitive to light, but also just being aware of them and planning for them if you have any kind of things coming up where you know that sensory differences needs to be accommodated for. So some of the examples that I've given you, there's nothing wrong with these at all. And I guess it's important to think that it's more about how to be aware of them and to have knowledge of them, but then also how best to support young people who might have hyper or hyposensitivities to things. So some of the examples that I've given you can produce small adjustments that can have a big impact for people on the autistic spectrum to feel included in activities in a really safe environment and in a safe way. I hope today's videos helped give some understanding about some of the sensory differences that people on the autistic spectrum might experience. It's just a small example of them, but I hope you found it useful. Thanks very much for watching, and I look forward to seeing you in the next video.